Welcome to CarolsJourneyTV. Today we are here at the Penthouse on 42nd Street in New York City. We are attending a PSI panel discussion hosted by 1199 SEIU. PSI, or Public Service International, is a global trade union federation representing 25 million men and women who deliver public service in 150 countries. PSI champions human rights, advocates social justice, and promotes universal access to quality public service. PSI also works with the United Nations system as in partnership with labor, civil, and human rights organizations. Maria Castaneda, Secretary-Treasurer of SEIU, and also the union representative to PSI International, hosted this event. Gina Miller, 1199 SEIU, helped coordinate this special event. President George Gresham of SEIU 1199 gave the moment of silence to those workers who gave their lives in the struggle to eradicate Ebola. And we also had a Q&A, and the wrap-up for that Q&A was Dion Palmer, President of SEIU Healthcare Wisconsin. The moderator, the distinguished Dr.LuellaToniLewis from the Healthcare Division and a member of the Committee of Interns and Residents, CIR-SEIU, the largest physician union in SEIU. Other members of the PSI delegation includes Jasper Goss, coordinator of the project and external collaboration of trade union development and education for PSI. Wendy Ware-Hinden is the PSI Regional Ebola Response Coordinator. She's a participant in the SEIU Global Alliance. Dr. Ayuba Waba is a trade unionist, the national chair of the Nigerian Council of Joint Health Sector Unions. He's also chair of the West African Health Sector Union Network and the national president of the Medical and Healthcare Workers Union of Nigeria. In 2015, he was elected president of the Nigerian Labor Congress. The whole emphasis and the whole essence behind this particular conference was to highlight the workers who gave their lives helping victims' struggles with Ebola. 500 workers lost their lives treating victims because they themselves had no benefits or safety preparations in treating these victims. Imagine 1.1 million healthcare workers of SEIU and 2 million service workers of SEIU who were affected by this Ebola epidemic. We give thanks and honor to the 500 workers who lost their lives.
I'm Ayuba Waba, the chairperson of the West African Health Sector Unions. I'm here to participate in the conference on recovery and how trade unions can effectively play an effective role in supporting their counterparts or our counterparts in Liberia, Sierra Leone, and Guinea towards recovery from the devastating effect of Ebola. Because health workers are on the front line of the pandemic, and therefore a lot of health workers in those countries have lost their life, and we are here in solidarity with them, and also to extend our support and solidarity to them so that they can be able to effectively respond to the challenge and also respond to workplace issues of occupational health and safety, and issues that will bring about a decent work agenda in the workplace and effectively will limit episode of health workers dying from Ebola. We are happy that 1199 have been able to provide this platform, and therefore we are extending our solidarity to those countries, and effectively will do everything possible also within our means to advance their issues beyond the shores of West Africa to other parts of the world, because injury to one is injury to all of us in labor space.
Today, Carol Journey is here in the penthouse at the 1199, and we're about to interview a gentleman here, Mr. Robert Wesley, and he is from Liberia. Basically, what we were talking about is what was happening with health care workers in Liberia.
Yes, thank you very much. I'm very much delighted to be here. And now it gives you a very good perspective of how people are concerned about the situation in Liberia. And one of the questions that was asked or comments that was made was about the kind of relationship that exists between Liberia and the United States. I myself was very much angry and embarrassed to see the situation in Liberia. Given our relationship, United States is like a big brother to Liberia and should have stood behind Liberia from the beginning, from the creation of that country up to now. And those institutions that should have been in place should have been there by now. So we hope and we pray that in the future, things will be looked at in a different perspective, so that the situation will not recur. And this is all why we are asking everybody to join hands and see how the entire world can help Liberia come out of this.
Hi, I'm the president of the Liberian community of New York, Mr. Paul Twitter. We came to 1199, one of the most powerful healthcare unions in America, to support their program to help Liberia, Guinea, and Sierra Leone. The program was very successful, so we hope and we wish that in 1199 we do more for Liberia, Guinea, and Sierra Leone with the Ebola crisis. This crisis is not only in West Africa alone. As we see, it went to Europe, including America. So hopefully we thought everything was fine in almost 2 months, and then just before the 1st of July, the ending of June, another outbreak in Liberia. After Liberia been cleared for almost 2 months, Guinea further away a month. So the conference that the United Nations having, hopefully they will do more, and then to help our health workers back home, because they're so underpaid. Thank you.